Welcome to another episode of Kidz Chat. This is Dr. Slaughter. Dr. G is behind the camera today. And today I have our first special guest, Nurse Practitioner Karla Washington.
Thanks for having me.
Awesome. Thank you for joining us. We're so excited. You're our first guest on our show. And I just want to talk to you. You're a nurse practitioner. And I really feel that it's important for people in the community to know what a nurse practitioner is, what your roles and responsibilities are, and kind of what your training was to get to that point. So, introduce yourself to our Kidz Chat audience.
Hi, everyone. Like Dr. Slaughter said, my name is Karla Washington. I'm a family nurse practitioner. So nurse practitioners are registered nurses who go through extensive training and board certification to be able to assess, diagnose, and treat different patient populations. So all of your nurse practitioners are master level registered nurses.
Okay.
There are some nurse practitioners who also hold doctorates.
Okay.
So nurse practitioners go through a lot of training
to be able to.
Okay,
awesome. So, question for you, because I feel like this always comes up. Are you a nurse or are you a provider? Because I feel like a lot of times in patients' mind, it's a distinction between, oh, this is just a nurse, but I still need to see a doctor or I still need to see someone else.
Right.
So, can you explain that for people?
So we're both. You
Okay.
get the best of both worlds.
I love it.
You get the best of both worlds. You have that compassionate nursing care that you're used to, and now you have a provider. You have someone who can prescribe medications, who can walk you through a very difficult condition or treatment, or time in your life at that moment.
That's awesome. And so you can see patients independently. And you can prescribe medications.
Correct.
And so a person does not need to see a physician in addition to a nurse practitioner.
Absolutely.
I think that's a very clear distinction that, is worth stating because a lot of times there is some confusion regarding that.
Right.
So you mentioned doctorate. So what exactly does that mean if a nurse practitioner gets their doctorate?
So a nurse practitioner that's getting their doctorate degree is just obtaining a higher level of learning and training in the nursing practice field.
Okay. Awesome.
So in the clinical practice field, I should say.
Okay.
So in terms of being able to treat our patients at the highest level,
okay,
that's the goal of getting.
So it's just a higher level of training. So then it makes you a super nurse,
super
which is amazing.
Super nurse, right?
Awesome.
Right, absolutely.
So now, and just for clarification, would that make you a doctor?
So we're not medical doctors,
okay,
but we will be doctors of nursing practice.
Okay. Which again, you say you can practice independently. See patients on your own without, also seeing a physician, prescribe medications, do procedures, everything that any other provider would do.
Exactly. There are a lot of nurse practitioner owned and operated medical clinics in DC and Maryland, which are full practice states. So,
very true.
Yes.
And now, can you speak on the difference between a nurse practitioner and a physician assistant? Because I also feel like there's some confusion when it comes to those two specialties.
So, physician assistants are excellent providers. I think the main distinction is that a nurse practitioner, depending on the state, can practice independently.
Okay.
Physician assistants will always have to practice with a collaborating physician, regardless of what state they're in.
Okay, that's very, very clear distinction. And then what about the training? Like, what about the training to be a nurse practitioner, to get your doctorate? Like, how long does that take? I know we have a lot of people who are inspired to kind of go down that career pathway. So what can you say about that?
So in terms of a nurse practitioner degree, it takes about 2.5 years.
Okay.
There's on-site clinical training, so you get hands-on training. There is intensive didactic training, which means, in terms of classroom training and just going through pathophysiology and pharmacology, things like that.
So a lot of what we do in med school also, so a lot of overlap with half the time.
Right? Because you're actually hoping that nurse practitioners have extensive nursing experience.
That's true.
Behind them too. So a lot of your nurse practitioners typically have 5+ years of nursing experience.
Which I feel is so important because being a nurse, and you mentioned it earlier, it's almost like just having that bedside manner, you know, and being able to relate to patients and just talk to patients.
Absolutely.
A lot of physicians, when we first come out of medical school, we go through residency, but you still don't have that hands-on patient care.
Right.
So I think that definitely even adds another, you know, layer to you guys just being, amazing providers.
Right, because, you know, in terms of being a nurse, you're used to seeing a patient or being with a patient for 12 hours at a time. So you get to know that patient, every aspect of their
family.
life. Exactly. So you bring that same perspective when you become a provider.
Yeah.
You treat the whole patient.
Yeah, I love that. Okay, so tell us about yourself.
Okay.
So what is your background? Are you currently in school for anything?
Yeah, so I've been a nurse for 12 years. I'm currently in school to get my doctorate.
Awesome.
My background is more acute care in the hospital,
Okay.
working with post-surgical, med-surg, ER, runs the gamut.
Okay. Very nice.
As a nurse practitioner, working with adults, peds.
Okay, so everything.
I love that.
So now, do you feel that your training allows you to kind of be able to switch into different avenues if you want to?
Absolutely,
Okay.
absolutely. I think the key thing about nursing is that it's very diverse. You can go into any specialty you put your mind to. There's always opportunity for training, learning new skills. So you kind of bring that to your your life as a provider too.
For sure.
And kind of just explore different
And that too is a difference, I guess, between physicians is that, you know, we go to medical school, we go to residency, we have to pick one specialty that we want to enter into. Whereas it sounds like for nursing and become a nurse practitioner, you can literally say, okay, let me start out in this field, work in that field for a little while, a few months, years, and then say, okay, now let me try this specialty without having to go back through a whole new program.
Right. Absolutely.
Which is awesome for versatility of career. I think that's really good. That's really good. Awesome, Karla. This has been extremely helpful.
Thank you.
So just in summary, a nurse practitioner is an independent provider who works alongside physicians as well as physician assistants to all provide care pretty much on the same level.
Exactly.
And then in terms of training, you said 2.5 years for nurse practitioner school, and then what about the nursing beforehand?
So beforehand, for a bachelor level nursing, you need 4 years of nursing school. So 4 years nursing school, 2.5 years to become a nurse practitioner, and another 2 years to get your doctorate, to become a doctor in nursing.
Okay, awesome. There you have it, guys. This has been Dr. Slaughter with Nurse Practitioner Karla with another episode of Kidz Chat. If you have any comments or questions, if you're interested in becoming a nurse practitioner or just have any specific questions for Nurse Practitioner Karla, please reach out to us. We'd love to hear from you. Thank you for joining us. We'll see you next time. Goodbye.